Okay, guys, so super excited to do this talk for you guys because, oh my gosh, I think this is a topic that no one gets right. You know, typically when we see people that come into our office with hip pain, they have tried everything. So, and just the stories and what people come up with, it's crazy. So I'm really excited to kind of navigate this with you guys and kind of explain a little bit about what's going on and why the hip can be pretty complicated to kind of figure out, but not hard to figure out. And we do it all the time. So my name is Stephanie. I am a physical therapist. I've been a physical therapist for, gosh, almost 20 years. I don't feel like I've been out of school for that long. Time definitely flies. But it's definitely a profession that I love because I love puzzles. I love figuring out things. And just, you know, I know the body has an amazing ability to heal if we give it the right environment. And even when I can't figure something out, it's just like I'm always constantly seeking and learning so that I can figure it out for the next person, or just following people through as they've been able to navigate different injuries and just learning from other things that they've done. It just constantly gives me feedback and information to make me better. And we have Ben here. I'm going to have him introduce himself. Ben is also a physical therapist. He is an orthopedic manual specialist. And he's been with us for almost a year, which is kind of crazy as well. So Ben, tell him a little bit about you.
So like she said, I've been here almost a year. As of September 4th will be a year. So I've been a physical therapist overall for about 5 years. I came on with Stephanie really because I just wanted to be able to spend some more time with my patients. I felt like I was at a clinic where, and I know Stephanie was talking about this before we started, just, you know, you start feeling run down because you're having to see, 15 to 20 patients a day. And here I think we really can take the time with people to figure out their problems. And, like she was saying with the hip, it's just so important to rule that out with, the lumbar spine, and just really make sure that you're having the right thing worked on. I think so many people miss that. And it's because a lot of it is because they don't have the time to really look at it the way it needs to be looked at.
Yeah, I think it's funny. Kieran in our front heat said, we do it kind of opposite here. Most places you have 2 patients, 3 patients per therapist. Here, sometimes you have 2 therapists per patient. So whenever we're always, listening to, like, trying to figure things out together as a team, it's kind of a team approach. And sometimes, when we're figuring things out, we always bring in other therapists. I have Lisa as well, who's not here. That has been with me for a really long time, and we will process things together so that we can make sure that we can get people back to things that they love to do without having to have the surgeries or the injections or the medications. That's pretty much the only thing that's being offered. So let's go. I want this. Okay, so what we're going to talk about today, why pain pills, medications, injections, and surgeries don't always work. Why MRIs and imaging leads down to more unnecessary procedures and treatments, and what healthcare providers miss due to many sources that can create hip pain. And I think that's the biggest thing, is that there's so many sources that can create hip pain, and it's trying to figure out where it's coming from and have an evaluation process that's going to help figure things out. And we're going to go into some of these things here in a second. Why will this not? So some ways on like how we can help. One of the things I always tell people is where the side of the pain is often not where the source of the pain is. And I think that's like the biggest thing. When you go into like healthcare and you go and you see someone and you have, let's say, just knee pain, all they look at is your knee. We had someone in here not just the other day, and literally they were going to another physical therapy office. Their pain was in their knee. And all they did was like do dry needling in their knee, doing cross friction on their like patellar tendon in their knee. And I'm looking at them like, oh, this is a hip problem. It's not a knee problem. And sure enough, we went and, showed her some of the issues and started resolving it, and her knee pain went away. And so that's just an example of like where the side of the pain is often not where the source of the pain is. And that's what so many people miss. It's what doctors miss, because all they go to is the site. And then I want to make sure that you guys stay tuned at the end, because we'll have a special offer at the end for you guys that are participating on our event. So some of the causes of hip pain. Decrease hip mobility. I think this is a big one that people miss. They don't look at it, or they only look at it in one way, or they don't really get you to in range and really test both sides, because you can learn a lot from that. Muscle imbalances and movement habits is another one. Muscle tightness, hips, IT band, hamstrings, quads. These are typically a symptom of stuff that's going on. So we'll talk about that. Because so often we go and treat the symptoms, we don't get down to the source of like, why is that tightness happening? And then it could be a back problem. It could be a thoracic problem as well. Like it doesn't always have to be like it's only a hip problem. We've got to figure out where is the pain coming from. And I think the third thing that I would, or the fourth or fifth thing that I would always also say is that there's a process to ruling things out. And doing things like in a step-by-step process. And if you miss that, then you're going to miss a lot of things at where the source is coming from. And we're going to get into that a little bit. So Ben, let's talk about, I want you talking about the medication injections and why they don't always work. So let's get into that.
So like you can see there on the slide, we really feel pain kind of 3 different ways. So, we talk about thermal pain. It's more, that kind of hot, cold type of sensation where, it's more like you burn yourself on like a hot pan or something like that. Chemical pain would be more of just the, kind of pain you can't get away from, because it's more like inflammatory type of pain. So that's like you have an injury that happens, it's those initial, stages where maybe you sprain your ankle and your ankle's swelling and it's really stiff and sore. There's not a lot you can do for it in that time period. And we almost need that type of chemical reaction to start the healing process. With mechanical pain, that's more like what we try to help people with. So that's more of those later stages where you can change your position and your pain changes. And that's really how we try to address it, is finding, better positions or modifying activities that you're doing to keep you active while you're going through all these things. But, and that's where exercise comes in to try to correct some of those things. But yeah, with the chemical pain, that's really why we like to go back to the medications and injections, and why they don't always work. Because if you're just trying to treat the chemicals, and you treat chemicals with chemicals, that doesn't address that mechanical part of your pain. And, like I was saying, the chemical pain is really only those first, stages when you're just in that inflammatory phase. And we almost we need that chemical stage to start the healing process. So, when we start doing ibuprofen, all these different medications just right out of the gate, sometimes it can slow down that healing process anyway.
Yeah, and it's also like most of the time when people come in and they see us, if you ask them what do they do, and they're like, I'm not really sure. Like I just woke up one day, or I just started or it just was a gradual thing that just got worse and worse. It wasn't like I fell and had this injury. I mean, we still get those, but I would say like 80% of the people, maybe even 90, are people that aren't sure what they did. And the good news about that is the fact that, well, it's something that you're doing throughout your life that we just need to figure out what that is to kind of start resolving and breaking that down to get you back to not doing some of those things. Like it comes down to like lifestyle changes. It's kind of like, if you're pulling your finger back and your joint doesn't like being in that position for 8 hours a day, day after day, year after year, your joint's not going to like that. We've got to figure out like we have to not pull your finger back. So if you're pulling your finger back and that's the problem, and you're doing injections and massage and strengthening and all these things, but the problem is really you pulling your finger back, we need to address that. So we need to address the things that you're doing throughout the day, and then come up with a game plan around that so that we can combat you from, having some of these repetitive stress or these postures that you're constantly in or have to be in for work situations. We come up with a game plan around that, because if you don't get down to the root cause of what it is you're doing throughout the day, then you're going to be going back into the same patterns, and then it comes back again, which again is why the surgeries and things like that don't always work. That leads us into why surgeries lead to more surgeries. It's kind of exactly what we're talking about there. It's because when you're doing a surgery, you never got into like what did you do that created some of these things? What is it that we need to address to get you back, so that you don't have to go back to having another surgery. So like back surgeries, for instance, it's like, if you have one back surgery, you're going to have 2 and 3, because you do the one and they do an easy one, and then you go back to the same activities that created your problem to begin with, and now you have this issue in your back, and you're going back to the same activities, but you're going to have that same problem come back up again, and you don't have any education as to what you're doing and what you need to do to combat that. And it's not about always, core strengthening. Same with the hip. It's not always about the strengthening piece of it. You don't get the mobility of the hip back. If that's where the problem is coming from, then you can't get the stability back, because you can't actually move in the positions to get some of those muscles to fire. And so that's that, we often are treating some of the wrong body parts or the wrong places. And if we don't get down to the source of what that is, then you're just, doing a surgery that may or may not work. You have anything else to add, Ben?
Yeah, I mean, I think it's kind of like you were saying. I mean, definitely finding out whether it's, because I think I've definitely seen people in the past that, they've had shoulder surgery when it was really coming out of their neck, or, kind of, and similar with the hip and low back situation there, because no one took the time to even screen that part of their spine. They just jumped right to where the source of the pain was, and they ended up having a surgery that, they probably could have went without. And I think this will probably take us to the next point where it goes along with the imaging thing. They just do something on imaging, and it leads you down a path, and no one ever questions it.
Yeah. We recently had a patient in here too that was having all this hip pain, and he had been having this, had really bad back issues like for a long time, and had gone through other physical therapy and doing injections, and overall got better to a point, but was having this massive like hip spasming, hip pain that was limiting him from like getting back to the things that he wanted to do, which was swimming and playing golf and those kind of things. He could not do them yet, but at least he could stand up and walk and function, which is, who wants to just function? And so he ended up getting referred to our office, and people wanted to do ART. They said it was all of the spasming in his hip. It's all coming from a muscle, and that's where his problem is. And I said, well, we'll see. And sure enough, I started with the hip, and I'm like, this is not a hip issue. I need to go back to the back. And so we went to the back, and literally when we got him in a position that got everything to calm down, you could not find a spot in his hip to reproduce the pain. So if it were really like a hip issue, like it's the hip and it needs to be, it's the muscle tightness that's creating all of his pain, there was no muscle tightness. There was nothing there. Now, if you moved him that created some of his pain, you could see everything spasm. But the only reason why that part of the hip was spasming was because of the referred pain. It wasn't a hip issue. It was a back issue. And so until you can understand how everything works and just kind of ruling pieces out, you're going to be missing things. And he would have gone to ART or doing dry needling or all these things that are addressing the muscle, when the muscle was just the symptom. The problem came from the back that was referring pain into the hip. And then when we got that figured out, now it's like he's not having as many episodes. He's moving. He's definitely progressing and moving in the right direction. He's able to, do more things like elliptical and other things to keep him active, where he wasn't able to do some of those things. So that's where it gets into you gotta figure out where the source is coming from. And there's so many different sources. So let's go into MRIs, why those lead to more procedures.
So it's kind of like I was saying earlier. I mean, if you take an MRI of somebody, you're going to find something. So like someone takes an MRI of your hip, they're probably going to find something there, especially if you're, middle-aged to, 60 plus. I mean, there's going to be something on there just because, it's a normal part of aging to have some of those changes over time. I mean, I like to compare it to just, you get wrinkles on your skin. Well, you're going to have wrinkles on that MRI too, inside the joints and, muscles and all the structures around there. But I think where that gets confusing is when, we see something on MRI in the hip or, shoulder, somewhere like that. And that starts leading everybody down a path where they're like, okay, it's definitely the hip. It's definitely the hip. Nobody bothers to even look up the chain at all to see if maybe it's your lumbar spine, your thoracic spine, or, vice versa.
Yeah, it's funny because especially if you do imaging around the hip, so you have hip pain, they image the hip. Typically what they'll find is they'll either find nothing and they don't understand why you're hurting. They'll call it like bursitis, or like a muscle, like a tendonitis. And that's just because they see inflammation around areas, which again, those are just symptoms that are going on. Or they'll find a labral tear. And a labral tear is like similar to like what you would think like a meniscal tear is to the knee. That's what a labral tear would be to the hip. Problem is that, like, again, it's one of those things, like Ben said, that as you age, you're going to find these things. Like, it's just a part of wear and tear of what we happen, just like having wrinkles on our face. So is that really where the problem is? And you do not want to have a hip surgery unless it's like, you know that there's a lot of degenerative changes and you're getting grinding in that joint. And we know, like, okay, a total hip replacement, you're gonna do fantastic with something like this, which we've had one person in here where I'm like, yes, you're gonna have to have the surgery. But most of the time, there's things that can mimic that labral tear, and you don't want to have a surgery like that at all. And the reason why, people will go into the hip, like even like if it's a chiropractor, or the chiropractor will say your hips are out of alignment, and it's funny because they'll come in to see us, and I'm like, okay, no, this really is a hip problem, and we will start addressing the hip mobility, then we work on the stability, then we get you back to where everything is functioning, you can get back to all the activities you want to get back to. And they'll go back to their chiropractor and they'll be like, oh my God, your hips have been like in place for a really long time. I'm like, yeah, because it wasn't that issue. Or you go to a physical therapist and you have that diagnosis of bursitis or tendonitis. And again, those are just symptoms. And so they'll go and they'll do the soft tissue or the dry needling or all these things around there, but they're not getting down to the root cause. So if you have a tendon and the tendon is inflamed, then it's not the tendon that's the problem. That's the symptom of like the muscle. The muscle's pulling on that tendon enough that is creating inflammation, and that's creating some of your pain. But then why is that tightness happening? Why is that muscle happening? Why is that muscle tight? And if you don't get down to why, then you're going to have those problems. Just like if it were down in your foot and you get like a tendonitis in your foot. If you don't go into like, well, why is that muscle tightening up? Is it because there's not mobility in the hip? Is it because there's referred pain that's coming from some other source, whether it be your back or your mid spine, thoracic spine? Is it because there's lack of mobility in the hip? Is it just because there's some weakness that's going on? I mean, there's so many whys as to that's happening. And if you don't get to that, then you're just treating a symptom. So they'll do soft tissue and then their pain will come back again. We'll have people who will do ART and it's like, I can't get back to running. But then they come in here and we're like, this is what it is. And we figured out where the source is coming from. And then we go start working on getting the strength so that everything sticks and stays. And then we get you back to those activities. So like I said, just because you see something in the imaging doesn't necessarily mean that's what's going on. Like you could take 100 people and 60 to 80% of them that have no problems, no pain whatsoever are going to show something on that imaging. So when you hurt and you image, is that really what's going on? Is the source that's coming from the hip really truly coming from the hip, or is it coming from something else? You just don't know until you go through a full evaluation. So here's some of the other things that healthcare providers miss. And we've kind of touched on a lot of these, but they only look at the site of the pain. So they only say, okay, it's only in the hip and that's all that we're going to look at. And that's a problem. You've got to really look above and below. I've had, my husband was playing tennis. He plays tennis all the time and he literally was getting hip pain. And I was like, this is, finally he got to the point where he's like, I need your help. I need you to look and figure this out. And so I literally started doing an assessment, moved his hip around. I could not reproduce his pain and at all, like moving his hip. So I was like, that's really interesting. And his strength looked really good. And so I knew that he had been complaining about like this thoracic, like mid back pain for a while. And I said, you know what, let's go up there and let's just see. And he was like, I don't understand. Like, why my hip is hurting. Why are you going all the way up here? And we put him on a towel roll to start like opening up, like doing some sort of self joint moves to the thoracic spine. And literally as soon as we put him in that position, the pain went right to his hip. He goes, oh my God, I can feel it in my hip. I'm like, yeah, the problem's up here. It has nothing to do with your hip. It's in your thoracic spine. So again, if you're only looking at where the side of the pain is, you're missing the boat, because there's so many sources that can produce pain into that hip. Another thing is they only look at the injury one way. So you go to a massage therapist and they're only looking at it from a massage therapy standpoint, but there's so many other components to it that you're missing out on, or they're only looking at it from like a dry needling perspective because the muscles are tight. Well, why are the muscles tight? Like, what's going on that's creating that? You have to get to that. Or they're only looking at strengthening. Like, we've got to go in and you're weak here, so we've got to work on the strengthening piece of it. Well, like I said before, if you don't get to the source of why the pain's happening there, when you have pain in your hip, your muscles aren't going to fire. They're not going to work because there's pain there. So if you don't get to the source of why that's happening, the strengthening piece of it, you'll be like, I'm in the same situation. Like, I'm not getting any stronger. I don't understand. And that's why. And a lot of times, you know, this is where I talk about people treat the symptoms in the wrong order. So maybe they'll do, you know, massage and strengthening, and like that's going to work. But the reason why it's tightening up for that massage, you're not getting to that why. And so you really have to look at the mobility of the spine, check, really ruling out the back, ruling out the thoracic spine sometimes, ruling out the hip range of motion. You've got to rule out the mobility, that you've got to be able to move in order for things to, because if you don't, then those muscles again aren't going to fire. Then you can get into some of the stability things. And so a big thing with the hip that I find that people don't look into, you know, they work on the lateral components, the hip rotators, because those are weak, but no one works on those hip extensors. And that's really a big component that people need to work on to get that stability, so that you're not recruiting muscles more on the outside of the hip or the front part of the hip. But again, you got to have the mobility before you can get that. And so then you can get into movement patterns. So once you kind of get the stability back, then you can start looking at breaking down the movement patterns that may be an issue. I mean, we had someone in here just this past week where she wanted to get back to cycling. And so she was getting strong and everything. She had the mobility, but the movement pattern that she was doing on the bike was locking her up. So we had to bring her bike in, look at, like really truly assess, like, where is the breakdown coming from, and go, this is where it is, where we could go and say, okay, you need to tweak this because you're always bringing your foot to the inside, it's creating this movement pattern that's kind of locking up that hip. So there's so many components to getting people back that people don't even realize. They think it's just simple, just give me some exercises and you're going to be good. And it's not the case at all. You really need someone that's going to be able to spend the time with you to like figure out what's going on and kind of guide you in that process. And that's exactly what we do. So here's just some success stories that we've had, you know, back pain success stories, hip pain success stories. They kind of, we almost clump those two together, just like we do with the neck and shoulder, because they're so related. If you don't rule out the back, then you're going to have an issue. You know, that's the first piece that we need to rule out before we go to the hip, because there's so much back issues that can create hip pain. But that's, I mean, you know, Sarah, who is the 45-year-old triathlete, she had been everywhere. She'd been to the chiropractor. She had been to doing ART. She'd been doing physical therapy. She'd been doing all these different things, and finally, like, went to her doctor and was like, I don't understand. I cannot get back to running. Like, I can cycle, but I cannot run, so I can't do my training. And literally the doctor, the orthopedic surgeon, who is also a triathlete, said, these hip problems don't have surgery with them. He literally said, do not have surgery. They're not successful. These just eventually go away on their own. You sometimes can get help with physical therapy, but sometimes you can't. And so she knew me personally and said, okay, I'm just going to go and see Stephanie's office. And so that's what she did. And so we found that she didn't have the hip mobility that she needed. And then once we got that back, then all that tightness that she was going to get ART for went away. And then we had to work on getting that stability back, which was really those hip extensors, so that she could do the activities and not compensate. And then, you know, within a month and a half, 2 months, she was back to running, you know, all the way around the lake with not having any problems. Needed a few tune-ups here and there, but I mean, gosh, I don't think we've seen her in a year. And she's doing fantastic and back to everything. So, you know, we have so many stories. I swear to God, I think the hip is like the most complicated piece that we see. Not complicated for us, but complicated in the sense that no one seems to be able to resolve this. So what do you take from this? Most injuries do not require surgery or medications. I've opened my new office. I've been here for like 3 years. It was not virtual, but I went to people's houses. And then after that, I moved into this office probably 2 years from December. But I think of that, I think we've only sent 5 people in those 3 years to surgery, like 5, that's it. Like that's how much we can help people avoid that, which then keeps that cost down for you guys and gets you back to being active and not having to worry about all the complications that surgeries come into play, as well as just not even wanting to do surgeries and staying out of the hospitals with all the craziness with the COVID that's going on. Most of the time your pain comes from somewhere else, and healthcare providers want to treat the hip and they only look at the hip, and they also treat everything in the wrong order. MRIs and x-rays don't help in guiding treatment or resolving the pain. And really seeing a specialist to help you figure out where the source is coming from. Like that's it, finding someone that really can figure that out will save you so much time, which time is money, and getting you back to really truly living your life the way you want to live it. So if people tell you that you can't be active and that it's not possible and that you have to live with this pain, it's just your age, you need to find someone else. Because I mean, we see it daily here. Like we have patients that are like 90 years old and 100 years old that are active and doing things and just loving it, because we've been able to progress people from here to even our Pilates program and doing Pilates classes with us. And it's amazing what these people are able to do. We just have to get you, resolve that pain to start moving you into being more active and getting you stronger so that you can live the life that you want to. And it's possible. And then really giving you that there's hope. There's hope that you can get back to living the life again and doing what you love to do. I think that's probably the biggest thing that we do up here is really give people hope, because it is possible. And even when we haven't been able to help people, we've been able to figure things out fairly quickly to basically say, okay, you know what? You're going to need to go and have an injection, or you're going to need to go and have surgery. But when people hear those out of that come out of our mouth, like it's so funny because it happens so little, because we don't tell people that very often, that they literally go back to like their husbands or their wives going, oh my God, they said I might need to have surgery. And like, they never say that. Like, I didn't think that they would ever say that. I'm like, so, I mean, we're not against the surgery. If it needs to happen, it needs to happen, but it's just so rare that it does happen. And we really want to be that resource for this community to really help guide them and to getting to where they need to be. Like, we want to be that, even if people don't come in and see us, we still want to help guide them through the process, because it's crazy what people go through, and I just hate to see it. So because you guys are here, we have several options. We have a thing that we call where you can talk to a specialist for free. It's a free discovery visit. We do this for people. We have only so many spots per week for it. But we want to sit down and have a conversation so we can really help you make a better decision about what you want to do, where you want to go, if we can even help. Like, it's just so that we can sit down and have that conversation. So we have that for you, and we have opened up 2 or 3 spots, I think, next week. I think some people have already taken a few of them, but there are spots open up next week for you guys. And we may have one this week. We might have one that we could fit in tomorrow. And then other than that, then we also have, if you want to come in for a full evaluation, we'll give you $50 off the evaluation price if you use that in the next 15 days. So you can still come in for a discovery visit and check us out and just see if this is something that you want to do, and you can still use that $50 off. So I want to give you just some other success stories that we've had. And some of these are people that have had back and knee and shoulder. But one of them, I'll go down to the bottom, Becky, she's someone that had lower back issues and had some hip issues as well. Also is kind of the same story. It's a common theme that we see. They've been to so many different providers, nothing really worked. And literally Becky got back to playing tennis when she'd been hurting for like probably 6 to 8 months and was having a hard time doing it. I think it literally took like 6 visits, maybe 7 total. And she was back to doing everything. And still is, and still does the same exercises and knows exactly what to do, because I see her ever so often, and she refers us people. She talks about us all the time because she's had so many bad experiences. So it is possible. That's the stories that we share is really just so that we can show you that it's possible that you can get back. And like I said, it's what we do and what we see every single day, and what we love about our job. So again, I wanted to go through one more time. Several options. You can talk to a physical therapist, one of us, for just a free discovery visit where we can kind of help you make a better decision about your health, whether you want to come in here or not. You don't, it doesn't, I mean, you can be like, yep, this is the place that I want to be, but it's still your decision. It's your choice. We just want to help you, guide you in that process, and we can talk about what the next steps would look like. Or if you want to come in for that full evaluation, you can get $50 off your first price if you use it in the next 15 days. So that is the talk, and I'm going to stop the recording, and we will answer any questions that you may have.